afternoon. How
Hola.
did everybody wake up this morning? How's it going? How's your day going?
Blessed.
Did you brush your teeth this morning? Or
Hola.
after lunch? Or did you have you ate dinner already?
Hola. Hola.
I just want to see if you brushed it. You know?
I mean, I would hope so. I mean, did you brush? I mean, why are you asking if I brushed? Are you guilty of something? You know,
That's the
say-
most important thing is to brush and then eat your meal. Your breakfast, your big breakfast.
Do you brush before you eat breakfast?
Do I brush before? Yeah. I mean, my food does taste kind of nasty because when I go brushing and everything, especially the toothpaste that I use, it just doesn't go good.
Yeah. Usually want to wait like 20 minutes though.
No.
You be in a hurry that.
Girl.
How much in a hurry do you
If
be
you only
in?
knew how my morning was,
Oh man.
it just, I don't have those 20 minutes there.
So what time do you wake up in the morning?
It just depends what days are you asking me.
Well, I mean work days per se.
Work days. I wake up at 5:30. Try to get ready to rumble. Start the day. You know,
Yeah.
wake up, shower, brush the teeth, and try to get out the door. But while I'm heading out the door, I'm trying to eat something, grab something to eat. But then that nasty taste in my mouth when I drink something or eat something is just like, ugh,
Wait.
nasty.
Yeah. When do you guys brush? Do you brush before or after breakfast?
Or do they not even brush because they think that they brushed last night
Well,
would count as brushing?
I would hope our audience would know a little bit better than that. But I mean, if they didn't, you know, what would you recommend?
Well, I think they should just brush every 3 times a day. Morning, afternoon, night, after each meal.
No, that's doing too much.
Oh, I'm sorry. Well, anyways, we left off in the last episode of how many cavities you had and how many cavities I have.
Yes.
And I want to know how many cavities did you have from like growing up to now?
Yeah, great question. And we did leave off with that, right? But we also asked you guys to comment. So let's go back and look at the comments. So
What did they say?
shout
Did
out.
they say?
So shout out to Diana for actually leaving us a comment.
Woo,
Hey,
Diana.
Miss you.
Our number one supporter.
We love ya. So Diana said Esme 5, Ellie 3. Ooh.
This way. I told you they had something on you,
That's okay.
but you didn't. You said no one sees me. Okay.
But you said sweets. Okay, so let's go to the next comment. So shout out to Jessica. Hey
Woo!
Jessica. So
Our second supporter.
Yes.
Our fan.
Thank you so much for your comment. So she said Maria 4, Ellie 4.
Oh, that's a tie.
Oh.
What does she know? Does she know that I've been eating with you?
So what are you trying to say? We have the same amount of cavities?
Probably.
Well, unfortunately, it's actually more than what the comments are.
What?
Not put together though. So don't add Diana's comment. It just
Like
says comment.
12? What was it? 3? Did she say 5 or 4?
Yeah.
What
Well,
did she say? 5?
Diana said 5, and then
Oh, so that's
Jessica
9 cavities.
Yeah,
Oh.
but no, not
No,
not
no.
adding both of those comments.
So which
together.
one was right?
So Diana was actually closer. Well, Jessica was 2 off, but I had 6.
6?
A total of 6.
Your
growing
whole
up.
growing up?
Yes.
Okay.
So I actually always had more cavities than all my other siblings. So yeah, but
¿No te cepillas los dientes? You didn't brush your teeth or what?
so
Or what was it?
yeah, for sure. So cavities don't just happen because you don't brush your teeth. There's actually a lot of different factors that actually cause cavities. But one of my biggest things that actually, led to getting cavities was eating chips. So you should know that I'm
Yeah.
a big fan of
Hot
snacking.
Cheetos.
Why you gotta say the hot Cheetos? You make me look
The
so
extra hot.
No, but even then, like, you're telling the audience, you're making me look like super bad. The typical Hispanic with the hot Cheetos.
Hot Cheeto girl up in here.
Oh no, are my fingers red?
No, I wonder why.
No, I haven't been really eating
Eating
hot
munchies?
Cheeto. Yeah,
Munchie
not as
ones?
much. So, growing up, it was always the chips, and so the tackiness, the crunchiness, all that stays on the tooth structure. So even if you brush in the morning, you brush at night, or you brush between meals, but let's say you snacked in between all that.
Yeah.
You know what I mean? So
you don't brush then. Yeah. Like you don't brush between snacking.
Oh, I was like, what do you mean you don't brush?
Like, no, because I don't brush when I snack. I brush more as in when
You're
I eat a big meal, because it's like snacking. Oh, I'm just gonna grab like a couple of bites. Okay.
Yes.
So that would just.
Yeah. So that was my major cause of why I got cavities all the time, because I'm not really a big sweets person. So, okay, so now you guys know how many cavities I had.
But what about the drinks, like sweet drinks?
Why is she ignoring that it's her turn to answer
Oh.
the question?
Because like you said,
but I'm asking you.
Oh, how many cavities I have?
She's trying to dodge the question. She don't want to tell us. I see you.
It's because I'm trying to hide from reality.
Why? Don't hide.
Because I don't know. Anyways, so.
You and your anyways.
Sorry, that wasn't. It was. But yeah, going back to how many cavities I have, I haven't had cavities. I did get some fillings done, but it wasn't because I had cavities. It's because I got x-rays done, and I was telling her, I was like, I feel very sensitive, but she didn't, it wasn't cavity there. I think what really happened is me grinding at night.
Mm-hmm.
And I also have a night guard that I don't use, guys, which you should use if you do have one, and the dentist recommends it. Definitely use it, because if not, you're gonna grind your teeth. But that's gonna be later on. I'll talk about that. But I didn't have cavities growing up, and I did eat sweets, and I love sweet sugar stuff. I love cake. And I don't brush after snack. I do brush at night, in the morning, because I do feel kind of if I don't brush. But yeah, I didn't have cavities growing up, and even now I don't. I only do have like sensitive.
The goody two-shoe over here.
I'm sorry. I just, and then, well, keeping up with the hygiene. My mom was really, brush your teeth now.
Yeah.
Take out your toothbrush.
Right.
She doesn't really know how to floss, but she does be like, brush your teeth.
How often did you change your toothbrush?
Well, I like then or now, or I just.
No, when you said your mom would tell you to change your
Well,
toothbrush.
we would change it every month.
Every month?
Yes, but it was like those like $3-4.
Got it.
Now
okay.
it wasn't the electric brush.
Yeah.
Yeah, no, those are. I think they're expensive. I actually wanted one, but I asked you for Christmas. Hey, you want to give me one, Esther? This will be a good present.
Guess what my response was?
No.
When that
It's
bonus
expensive.
hits. When that bonus hits.
I'll do
I didn't tell you no because it's expensive.
It is expensive though.
But that wasn't my response.
No, but I was like, she probably didn't get it because it's expensive. Because I Googled it, I said, let me see how expensive this
mind
toothbrush
you,
is.
wait a second. Wait. Let's back up for a second. So, on her Christmas list for work, there was no electric toothbrush there.
It wasn't?
No.
Oh.
She had a Stanley. She had a coffee maker, like an instant coffee maker, like those cute ones. Girl, there was no electric toothbrush there. But
I probably forgot.
You did tell me though, like after the fact, but I had already bought her like coffee thing, so like I didn't.
More sweet added to my teeth.
And then on top of that, she wanted me to buy her a fix set.
Yes.
So I was like, girl, wait till that promotion or that bonus hit.
Let me just tell y'all, it's not because I don't have money, but because figs are very expensive, and I haven't, to be honest, I haven't even went to the website to look at them, because I'm like, no, they're expensive, and they are expensive, but they are really good quality. Like I love them, but I have just never had the chance to purchase them, so I'd rather just go to a Scrub and Beyond.
That's why you guys have to share and subscribe and continue to share, so Ellen can get her
some figs. You wear figs now? What do you think about them?
They're comfy.
Not that they're paying us to promote them right now.
Right, exactly. No, they're actually really comfortable. I tell you, like, maybe within the last 5 years, like, I love the jogger style scrub set. Like I can't do flared or
Really?
regular. Yeah, I can't do it anymore. So ever since I
What
tried
do
the
you feel?
jogger, I just feel like they're snug and they
Oh.
kind of feel like an actual jogger, like you're comfortable. The other ones, I guess because you know where I come from, and that's why I said 4 or 5 years, from Michigan. In the snow, like sometimes you would get snow all over on the bottom parts and stuff like that.
That's why you don't.
So
Yeah.
I kind of wasn't like a big fan of the flared or the regular. But after I tried the jogger style, like they're so comfortable. So I haven't gone back to like regular.
Oh,
like, the
okay.
flared. I haven't.
That's why I asked her for electric toothbrush because I said she's wearing fake. So I didn't have no cavities growing up. So Diana and Jessica, I didn't. Mine's a 0. I just had some fillings done due to me grinding at night, not wearing my night guard. So there you go. No cavities up in here.
Lucky her.
I didn't get a prize for no cavities, but it's cool.
Hey, that's awesome. Well, good for you. So yes. So actually, that's a good thing that you bring that up because sometimes some people may not need, not have cavities, but they do need fillings. And in your case, what was happening is you were wearing away your tooth structure. So you were feeling sensitivity, right?
Yeah.
So then that's exactly why she needed to have a filling to help protect her tooth. Okay. So, but let's talk about cavities. So, what are cavities? So,
what are cavities? How are they formed?
Yeah. So actually, there's different things that actually cause cavities. So
Is it sweets?
It's a lot of things. So sweets is one. Lack of oral hygiene is another. So if you go back to sweets, we're just going to talk about dietary.
Yeah.
The way you eat. And then we can talk about home care or like, not brushing, not flossing. So, basically hygiene. But also patients. So elderly patients actually have something that's called xerostomia. Do you know what xerostomia is?
No, what is that?
So xerostomia is dry mouth. So it's just a technical term for...
Well, I just know dry mouth.
Yeah, so xerostomia is a technical term for dry mouth. But what happens is older patients are on tons of medications. So what happens is they decrease saliva. So saliva helps prevent cavities from happening. So the more saliva you have is actually good. Some people tend to think like, hey, well, I just have a lot of saliva. It's not a good thing. No, it's really good because that's helping cleanse your oral cavity. So that's a good thing. So, but again, going back to elderly patients, a lot of times they take all these medications which decrease the salivary flow.
I was just gonna ask you, is it the medication or is it them getting older?
No, it's
But
the
is the
medication. It's the
right.
medication that decreases the saliva flow. But what happens in elderly patients is older you get, you have bone loss, right? You have gum recession. So your bone is not at the healthiest level, so it starts to decrease. And then your gums get exposed, right? And then now you have what covers the root of your tooth is called cementum. So now your cementum becomes exposed, and cementum is very soft.
So is this happens due to the medication also, or is it just so if you don't have a lot of saliva?
Correct, because
you start getting all these.
Yes, you start to get what are called class 5 cavities.
Yeah.
Because your gum is recessed, and then you don't have a lot of saliva cleansing, and then it gets on the cementum, which then causes a soft spot and then causes a cavity, right? So there's different layers of tooth structure. So the outer layer, which we have that covers the actual crown of your tooth here, and I know this is a little too far back, but this outer layer here is your enamel. And then in the inner side, and I'll show you guys a diagram in a little while here, but the inner surface is called the dentin, and then you have your nerve, which is, what do you call the nerve, Ellie?
What do I call the nerve?
What do we call the nerve? Pulpal.
Oh,
the pulp.
The Pope.
There
I was
you go.
like,
You're
what do
like,
you wait?
So I was just quizzing you.
Yeah, I was like, wait, what do you mean? The nerve, the Pope? I'm like the one that does the blood supply?
Yes, the nerve, Ellie.
Because the nerve is the blood supply, right?
Well,
It's just,
the pulp is composed of blood supply and nerves.
Yeah.
Okay,
and if you
so
don't have that, then what
you don't have any sensation.
It just becomes
non-vital, which means it's dead. Okay, there's no more nutrients. So basically, what your blood supply and your nerves do is they filter throughout your tooth to give you sensation, stimuli. It provides your tooth with nutrients, so it keeps your tooth healthy. Okay, so the nerve is the inner portion of the tooth, which is what we call the life of the tooth, right? But then on the outer side from the enamel, because the enamel is covered by the crown of your tooth, underneath your gums and near your bone, you have a surface called cementum. So that's what we were talking about a little while ago. When elderly patients start to have gum recession and bone loss, that surface becomes exposed, causing them to have root caries. So it's very, very
Important
dominant
to have
in elderly patients.
to have saliva in.
Yeah, and then also, like you said, dietary, like the sweets and stuff. And then patients too that are going under chemotherapy
Yeah.
or radiation, they're also, their immune system becomes compromised, so they're also at increase for root caries, rampant caries. And then, have you heard of meth mouth?
No, I haven't heard of that. I think I just heard a little bit, but never like went into deep or anything, or asked the person or whoever was speaking about. Like, okay, didn't
Yeah.
really care for it, but because at the time I was just not into dentistry,
Right.
but I never asked for it.
For what it
But I
was.
really didn't know about the saliva thing. I
Yeah.
thought it was just, the medication. And now that you're talking about the radiation and everything, my mom was actually going through radiation in November, and she would tell me, "Hey, I'm not laughing. I'm laughing the way she would say. She was like, "Hey," she's like, my mouth is dry," and I'm like, "Ma'am, that's not a good thing." And I actually talked to the doctor, and I said, why? Well, the dentist.
Mm-hmm.
You're a dentist. I asked her because
She's your dentist.
she's our dentist.
And your family dentist.
Yes, and I asked her, I said, why is it that radiation causes that to have dry mouth?
Yeah.
And she was explaining to me
Mhm.
that medication takes away your saliva, and it just happens.
Correct.
But it was just that temporary. After that, she
was
went
able
back to.
Yeah.
So I guess normal, because she wasn't getting that much radiation
Yeah.
or anything.
So that's good. And they actually have, I don't know if you guys have seen, you probably haven't because it's not something that you're constantly looking at. But if you know anybody who does have xerostomia, or you've heard it and you're like, well, I don't know, that's kind of like, what should they take? There's biotine. You have biotine that you can get over the counter, so you can get that. A lot of doctors will recommend that for dry mouth.
Is that like probiotics for your mouth?
I wouldn't say probiotics precisely, but it's a stimulant, so it helps
Okay.
activate your
Yeah.
enzymes. But hygiene. So if you don't brush your teeth, okay, then obviously that
Maybe
plaque
cavities,
stays
yeah.
on there, okay, and then
Flossing between your teeth.
correct. So actually, growing up, I wasn't a big thing on flossing.
I'm sorry, but I don't. Y'all tell me not to do the
Picks.
the pick tooth floss. You know what I mean? The one
Yeah.
that has I use those, and I know they're so bad for you, but I just feel so easy.
Yeah.
Let me tell you a quick story. The other day, my husband / boyfriend husband.
It's her fiance.
Whatever you want to
It's her
say.
husband.
My fiance. If you seen this, I'm so sorry, but sorry to expose your business out there. I said, hey, I was like, come here, let me floss your teeth.
You know there's HIPAA regulations here.
But
I'm
no
just
name.
joking.
There's no name or anything.
I'm just kidding.
If you know, you know. If you don't know, then you don't know.
Mm-hmm.
You can Google or Instagram or whatever. So I told him we were out of the country, and I said, hey, yo, and then I had that floss from our doctor, because I always carry it in my purse, and I don't like using it because it's a very special one that I'm like, oh, it just smells so good and everything. So I just kept it in my purse. I was like, one day in emergency I will use it. So I said, come here. I was like, let me floss your teeth. And I started flossing. I'm like, man, this is so hard.
Yeah.
And because we were in a third world country, it's just like,
Yeah.
we didn't go to Walmart to go buy it. And then if we did, I forgot about it. And I was like, I have some in my purse.
Yeah.
So I was like, come here. And then we came back, and he said, can you floss my teeth? I looked at him and said, no.
We're not on vacation
No,
anymore.
that was only that one time. And that's it.
Yeah.
But he got spoiled, and he wanted me to floss his teeth, like the flosser and everything. I was
Yeah.
like, here, you can have this. Just floss your teeth by yourself.
By the way, she's talking about cocoa floss. If you have not tried cocoa
Oh,
floss,
it's amazing.
yes,
It's
you
like,
all need to try it. And at Cleo Dental Studio, we sell it. So if you're ever in the Houston Heights area, just come on by, and I'll go ahead and sell you some. So
we'll post later the address and everything.
yes.
I want to do a special episode just for that.
Yes.
But the floss is amazing. I have never used a really, really awesome floss, and and he tells me, can you floss my teeth? And I'm like, not with this. You better go get the Colgate, the Colgate one to give you. So there he comes, and I'm just like, oh. But
have you ever tried a water flosser?
I haven't. I've seen them.
They're amazing.
I've seen them, but I have not. I think.
But you shouldn't replace that for manual flossing. So water flosser comes good in hand, especially if you have braces.
What do you mean?
So the water flosser.
But you said the manual.
So manually flossing.
Oh, manual flossing.
You shouldn't replace a water floss completely.
Yeah.
With manual flossing. So with going in there. And you mentioned picks. Picks are good for emergency situations. Yeah, yes,
No, I don't recommend them. Don't use that. Only if it's an emergency.
But why don't you recommend them?
I don't recommend it because they're wood. First of all.
Well, there's different ones too. Not you. There's the plastic ones too.
Well, when I go to the restaurant, I'm like, let me get one.
Oh, you're talking about toothpicks.
Yeah.
I thought you were talking about the little flossers that have like the little hoop
with
the string.
Yeah, I don't recommend those either. Yeah. I don't recommend none of that. I just recommend like the regular floss or the floss with you know. But I don't recommend the wood ones because they're made out of wood. Even though they're really thin, they're made out of wood, and then when you poke at your teeth, you make a space.
Correct.
Like, you don't see it, but if you was to get some loops, you can actually see that. And then sometimes you can leave like little
the wood remnants.
Yeah. So I was
trying
to Spanish, but you probably look at me. No, yeah. So I don't
definitely separates your. Yeah. So yes, no matter what, we definitely will recommend manually flossing. And so it doesn't matter, you definitely need a floss. So yes, for emergency situations, I mean, the point is to get whatever you have stuck. Yes, guys. So we highly recommend flossing manually. Okay. Doesn't matter if whatever you're doing, a water flosser, it's good. Water flossers are actually really good for when you actually have braces, or if you want to do it in the morning, but don't completely replace it with manual flossing, okay? Because manual flossing definitely gets in between the tooth surfaces and
in between those good contacts
exactly.
that are really tight.
Yes, because your toothbrush doesn't get in between those areas. So definitely floss.
And even though I know some people are when they go to the dentist, like, oh, you need to start flossing, and you start bleeding, is because it's like I don't know how she explained it. She was like, it's a cycle that you need to do it, because the more you do it, the less it's gonna bleed, and just because your gums are inflamed, that needs to be flossed between them, especially because, like I was telling you, it's the same it's a really tight contact,
right?
Your toothbrush gets back there.
Yeah. So the thing about the mouth and the oral cavity is it's very different from the rest of your body. So a lot of people may think, oh, because I have a scar, I don't want to be picking at it because it's just going to continue to bleed, right? So some people have that in their mind where they're just like, okay, well, I don't want to touch the area because I'm just going to make it bleed more, right? But in the oral cavity, it's actually the opposite, because you have something in there that needs to be cleaned out, so you definitely have to go in there and clean it out. So it's the opposite, guys. So if you're bleeding while you're flossing and brushing, you definitely need to get a grip on that, because if not, your gums are gonna start to get inflamed, and you're gonna have what's called gingivitis, which is inflammation of the gums. And so yes, we definitely recommend manual. I mean, just flossing in general is like extremely important, but manual flossing definitely. And to be honest, it doesn't matter. I wouldn't say it doesn't matter, but if you're gonna pick and choose when to floss, because some people are a little lazy on that, definitely recommend flossing at nighttime. Yes. Because you don't want to go to sleep with all that gunk in between your teeth overnight. Okay?
Yes, nighttime is very important.
Exactly. So keep that in mind.
Yes, and that's something, how to prevent cavities from getting inside your tooth. And it started off when the tooth structure start off first with the cavity, and then it goes to worse, either extraction and root canal and all that stuff. That's the reason why you get a crown and everything.
It depends how deep it goes. Yeah. Because you can have a cavity, and you can just get a filling done, right? Or there's different type of fillings. So there's two, but hardly ever do you see dentists do the silver filling anymore. So a lot of times you'll see the white.
I don't think they use that anymore.
Yeah, some places do. It's not very common.
Yeah.
But it's still out there.
Well, since I've been in dentistry, I have not had a chance to see the silver filling. I think that would be pretty cool.
There's
to
a lot
see
of regulations.
how to do
Like
it.
you have to have like in your plumbing, you have to have like an amalgam separator. In our office, we have a separator, but our doctor actually uses something even cooler. Like she has this amalgam unit that goes into the HVE, and it kind of suctions and it traps the amalgam, like the mercury inside of that, and that you would throw and put in a
So
kinda
does
like a
does she
biohazard
do
container.
amalgam filling?
She doesn't, but when she removes them,
Oh, okay.
that mercury
yeah.
stays in your traps, so you don't want that.
Yeah.
So it's a good way to filter it out so it doesn't stay in her unit.
I've seen them when they take it out, but I have never seen it put it back in.
I actually used to pack
Really?
amalgam, and that was like when I started dentistry. It was all like more likely amalgam. We're talking about 18 years ago.
Oh.
So
Yeah, no. Well, when I was going to school, they only taught me the composite one, the white filling one that they use, and then I've been at other locations and they only use the white ones, and I'm like over here like I don't know, I want to see the silver one, but I mean you said some dentistry, but I guess the one that I haven't been, the ones that I have been to, they only do the white ones.
Yeah, they do. But you'll see them more at like like community health areas and stuff like that. So
because they do
and
use
that's due to cost.
They do use the silver capping, the silver crown.
But that's for the bad kids.
Yeah. My kids have some, by the way.
You have some bad kids.
Have you seen the ones with the two front ones?
The
8 and 9 silver, the little kids.
Is it 8 and 9?
It's not 8 and 9. It's because I don't work in kids. I work more in adults, and it's like 1, 2, 3, 4, not ABC. I'm like, what? Wait, where?
Yeah, it's 2 letter E and F.
Well, I'm sorry, guys.
It's okay.
It's
You got no reason to apologize.
I just don't work with kids.
Yeah,
but
it is difficult.
Yeah.
Have you ever like assisted in pediatrics?
Yeah, no, I done kids, but not like a special place where they do like.
I actually had an interview, and this was maybe this was a long time ago, but back when I lived in Michigan, my best friend, Gabby. If you're seeing this, shout out.
Comment right now.
She actually referred me to the doctor that she used to work for, Mortar Dentistry in Dearborn, Michigan. So I went in for an interview, and he offered me a job, and I couldn't, like
with kids.
we had a baby. Maybe she was about 4 or 5 months in the chair, and she had an extra tooth growing, so we had to remove it. And just having to hold her, and then the mom. I can't do it. I'm sorry.
I mean, I have kids and I have babies, but it's just a different thing. It's also when you go to the doctor, it's like if you work in the health field, it's different being in the chair than being assisting somebody. That's how I feel when I go to the dentist. I'm like, I see what they're doing, but it's so different being in the chair. So when I take my kids, I'm like, I'd rather be the mom than be the assistant because I just can't. I can deal with my own kids, but I'm not everybody else's
So,
kids.
and another thing too, it's like, I even worked at U of D Mercy, the dental school back in Detroit, and we had a pedo area, and in that pedo area, we saw a lot of pediatrics, so we would help assist the students, work on the patients. But you had to tell them every little thing you do. Basically, you have to tell, show, do. So you got to tell them what it is, you have to show them how it works, and then you have to do it. So it was like 3 times the work. So draining that I just like...
Repeating yourself.
All the time. Are we there yet? Are we there yet? Like, no thanks. But yeah, so anyhow, just stick to adult dentistry.
Yes.
So,
I mean, some adults do act like kids, but that's okay. So, the cavities, that's the way to prevent it is flossing, brushing. You recommend 2 or 3 times a day, whichever one, 2 or 3 times.
I'd say twice, but what's really important is the type of toothbrush that you use. So obviously you want to use an electric toothbrush. Okay, we're not talking about a toothbrush that has a battery where it's a removable battery. You need an electric toothbrush that actually connects to an electricity. Okay, that is the best type of toothbrush to use. I personally have had both. the Philips and the Crest Oral-B, and I love the Philips brush. I did not believe doctor when she told me like you're missing out. Philips is better, and I'm like, nah, you know, I really like Oral-B. And then she's like, no, you're missing out. So we actually had a rep come out a couple months ago when we first opened our office, and I haven't been back to Oral-B since I've tried Philips.
Well, you know, funny thing, I was telling you that I only had manual, the hand one. I didn't have no electric toothbrush, and I've been asking you, going back to the beginning, asking you forever that I wanted one. Well,
what she think, I'm a sugar mama? Like,
no, you're just my really good friend. Well, you were my manager, so I was like, let me ask my manager. Maybe she can give me a little hookup somewhere and give me a, you know, for a discount price. Not that I'll go everywhere and ask you for a discount everywhere I go, but I was like, maybe she can talk to her boss and be like, hey boss, can you let Ellie have a little 20-30% on the toothbrush? But it's okay because I got one for my own actually.
That's good.
I recently got it, and when I first got it, I was like a baby with cake, a little kid with cake.
I actually did an ASMR video on unpackaging. It was really fun. Loved it. Y'all need to get one. If y'all don't know what to do or how to get one, just write us a message. We'll help you. Sometimes they have promotions.
I think yours, the ones that y'all sell, have a 2-year warranty, no?
Correct.
Because the one in Walmart and Sam's and everything, Costco, they don't come with that, right?
No, they don't have the warranty.
Yeah.
But we also offer coupon, like rebates with it. So, yeah, y'all just, you know, let me know if y'all are interested. By the way, y'all need to come and see us. Y'all need to come and book an appointment, get your hygiene, have a consultation with my doctor. She's amazing. So y'all need to come and see and check us out. So
yes.
And also going back to like what we were talking about, the cavities, and just the important thing is making sure you're brushing, you're flossing. You can eat whatever you want. You can snack. But the point is, if you can't brush after you snack, at least rinse with water, because you want to get you want to remove all the debris that you have currently sitting on your teeth so it doesn't break down, causing cavities.
Especially at nighttime, because you're eating all day, and let's say you did forget to brush them in the morning, which it's no biggie because I believe at night you're not even eating, but
right.
But at night is when you're like, okay, it's like the same way as you shower. You know, if you shower at night, which I think everyone probably do, you know, if you shower at night, then you should definitely brush your teeth, you know.
I shower, it just depends. Like, obviously, if I had the day off and it's been a while, like, you know, like I was doing stuff, then I might shower, during the day. And then, you know, it's.
But I think everybody will.
I don't really shower every single night. So, no, not every single night. Because, like, I'll shower either before work or sometimes, like, after I get out of work. But I get what you're saying.
Just brush your teeth.
Just brush your teeth.
Just brush them, and it'll prevent you from having cavities and all that stuff.
Exactly. And not so much just for cavities. Brushing your teeth helps your gums as well. Because if you don't brush your teeth, you don't brush your gums, because you're not just brushing your teeth, you're brushing your gums, because your toothbrush should be at an angle where you're into your gum. And for that reason is you're removing any debris inside of that area as well, and it stimulates the gum surface. So you're removing all that stuff and all that gunk, so then that way your gums stay attached, they stay healthy. So
doctor says your toothbrush, the electric one, shakes like an earthquake.
Yes, so it removes all that plaque, all that debris. So yes, it removes all that debris, all that gunk all over the gums. But that also helps prevent gingivitis and leading to periodontal disease, which is going to be our next episode.
Yes.
So we're going to be talking about gum health and
how to prevent it. Correct.
Have you ever been to the dentist and they automatically tell you need a deep cleaning? And a lot of people actually get confused because they don't know the difference.
No, that's a good thing you brought it up, because when I go, I'm like, when I first started, I'm like, I just need a cleaning on my teeth. I don't know. I used to go to the dentist when I was a child, when I was a teenager, every 6 months. So I was like, I just needed one of those cleanings. And they looked at me like, okay, so do you want a deep cleaning or do you just want? I'm like, I don't know. It's like going to.
So they would ask you which one you wanted?
Yeah, like which one, like what are you coming in for? Are you coming for a regular cleaning or are you coming for like a deep clean? I'm like, I don't know. I'm like, I don't know. You tell me. Yeah. And then, they would take me back and they explained to me. I'm like, oh.
Yeah.
And then going inside dentistry, I was like, oh,
Yeah.
okay.
See, but a lot of patients, and you guys probably don't understand this, but you can't just go to the dentist and say, I just want to clean. You know, like there's more to that. Like we cannot tell you what type of cleaning you need without having x-rays. Because you're the only way to tell what you definitely need is by x-rays, because you may seem or you may think like, oh yeah, I just need a regular cleaning, just like, you know, a lot of people do,
Yeah.
you know, but without actually seeing the depth of the bone, without seeing if there's calculus that's lodged into your gum surface underneath that is not visible to the eye, like we don't know that. So we can't just say, oh yeah, you just need a regular cleaning. So a lot of times patients give us a hard time because they're like, well, I don't want to take any x-rays, like I don't need
I
that.
just need my cleaning done now because I'm going such so whatever the story, whatever the scenario
or a
is.
lot of times they just say, well, I don't, that's bad, like I don't want to have radiation. But have you guys ever been to the dentist and they told you that you needed a deep cleaning, but you never had a deep cleaning before, and like let's say you were a regular? So let me know, do you ever feel like you were misdiagnosed?
Or what kind of cleaning did they tell you needed?
Yeah. So drop down in the comments. Let us know what you thought about our episode. Hopefully you had a great time here with us today. And looking forward to seeing you guys next time.